marketing, it takes time. So if you're out there and you're listening, hang in there. It takes a couple months.
This is Growth in Dentistry, a dental intelligence podcast, where we ask the question, what does growth in dentistry mean to you? I'm Steve Jensen, a data dental nerd and your host.
Welcome everyone to another episode of the Growth in Dentistry podcast. Now, today I'm going to jump straight into the episode, mostly because of how excited I am for our guest. So this episode is a part of our practice deep dive episodes. As a reminder, if you haven't been here before, or if you're a continued listener and it's been a minute, these episodes, I go and find the highest performing dental practices in the US, and I bring either their owners on or the office manager or admin team on to talk about what they're doing, what strategies are they taking to get exceptional success, up way above average. And in this case today, it was fun. I was telling Dr. Dolan before we started recording that I was like sifting through his business to try to find like kinks in the armor, like where is he weak? And he is just running a top performing, like top 10% in every metric I could find in his business. So I'm super excited to have him on today. So without any further ado, welcome, Dr. Dolan. Thank you for joining.
Yeah, thank you. Thank you for having me. I'm excited.
And then I also, just for listeners, I also have Riley Beck on here with me. Riley has been in dentistry for a long time. He actually used to work at Dental Intelligence, now is working at Energize Marketing Group. He is brilliant. So I'm excited to have this. Is the first time actually I've had a partner and a dentist on at the same time. Riley is also a data nerd and knows Dr. Dolan, and he's the one that made the intro. So I was like, hey, let's all three get on and let's talk. So Dr. Dolan, do you mind giving us a little bit of background about kind of yourself? So, how long have you been out of dental school? Where'd you start? And just so for listeners, he had a scratch practice he started in 2021, and we're going to kind of talk through that story, the growth, how you approach growth, and how you got to today.
Yeah, well, thanks for having me on. I appreciate it. I'm excited to hear. So graduated from Temple Dental School in May of 2019. So I've been out of school for about 5.5 years now. Right from school, I went right into practice and practiced as an associate for about 2.5 years before starting Dolan Dental from scratch in December of 21. So we just had our 3-year anniversary here. During those first 2 years, I jumped right into doing general dentistry and was kind of like a weekend warrior doing CE classes, just, constantly trying to up my game and, do better dentistry, but, higher producing dentistry as well.
And did you have, were the doctors there, were they doing some of the bigger cases as well?
So we had a periodontist,
implant
prosthodontist on staff.
Okay, cool.
So, he was doing most of the higher stuff. But he was great. He would let me watch some stuff and
Cool.
teach me.
Some exposure there.
Yeah, absolutely. But really, I didn't really start getting into that stuff until, I had my own practice where I could kind of, do whatever I wanted.
Okay, sweet. And then tell me, was your plan coming out of dental school always to like have a shorter associateship and jump straight into scratch practice? Like, when did that idea get into your head? You're like, okay, like I'm gonna just send it and I'm gonna start a practice.
Yeah, so senior year at Temple, Ideal Practices came out and went to, their lunch and learn. And I thought it was really interesting. I'd never even thought about that before. Coming out of school, really, I was looking for an opportunity to work somewhere and buy in. And that's kind of what I thought at the previous practice that I joined. 2 years in, I realized that it might not be a possibility and, wasn't 100% the practice for me. For the time I was there, I'm very appreciative, learned a lot. Sure. But at that point, I was like, I want kind of control for myself and to use some of the things I gathered at that practice, good and bad, put it all together and, kind of create my own spot. So that's what we did.
Okay, yeah, I think, oh, go ahead, Riley.
I'm curious. Working as an associate just for a couple of years, what were some of those key moments that you're like, you know what? I can step full-time into practice ownership for you?
Yeah. Well, one, we had a periodontist prosthodontist on staff. So whenever those cases would come up, they would go to him. So I was always interested in implants and surgery and stuff, and not really being able to do that, being a little handcuffed with that was one major one. Um, Also, I felt like, uh, like as a leader with the team that I was given, I felt like I was pretty successful, even though, I have a different leadership style than, the owner that I used to work for. But I just started to really like it and, create relationships with people and realize that, maybe I can kind of lead a team and do this on my own. Which I'm glad I did. I really do enjoy it. It's a good part of dentistry that most medical professionals, aren't given, that opportunity.
Mhm. Now I want to get to the shift from being an associate to being in your business, because I think that's a big jump. I think a lot of people listening that are associates will relate with your story, like this feeling of, man, I want more autonomy. I want to be able to do some of these cases. I have these interests, but actually making that jump is a scary moment in your professional life. And for some, they go and they crush it, but then for all these crush it stories, people also hear the like flop stories where it's like, oh, dude, like this is like really painful. So talk us through maybe some of the way you approach, because you jumped and moved into practice ownership successfully. Tell us about kind of the transition there. How did you transition from associate to running your business? And what are some of those key things you put in place to make sure that it did go successfully?
Yeah, great question. I think that when I started, it was a great time for me because
Mhm.
I had learned a lot, but wasn't able to really practice it. When you're a startup and you have zero patients and somebody comes in and says, I want this, it's hard to say like, okay, well, I've only done a couple of them, like go see somewhere else. You're like, no, I'm going to learn it, so whether it would be learning it, asking friends how to do a case or, going to a course and then coming and doing it, or just manning up and, feeling comfortable doing it. Whatever, the case would be. Luckily, I have a good support system. I have a bunch of friends and people that I talk to and go over cases. So I felt confident, even, you know, surgeons and whatnot that I can bounce ideas off of. Um, Also, the technology that I have really made it easier for me to do some of those harder cases. We have a scanner, we have CBCT, we have 3D printer. So a couple cases would come up, and I would say to myself, I could do this case if I had a CBCT or a 3D printer or whatnot. And I'm like, I'm going to get that anyway. Let's just buy it now. So probably
So you opened doors with all of that.
pretty much within the first three
Wow.
months, I had everything.
Mhm.
So, huge overhead, but at the time we had time to learn all this stuff. We weren't as busy. And it just kept a lot of cases in-house, made me feel super comfortable about what I was doing. We can take a CBCT scan and know, how I'm doing with the implant placement, to see if I can even do the case. We had a 3D printer, we can make a guide, milling crowns and temporaries and stuff. It just really helped with me feeling confident enough to do the case. Just
Mhm.
investing in that technology early enough.
Let me ask another question too about your strategy from a team size perspective. And kind of one of the things I've learned is I've met some of these, really high performing practices. They take like a unique stab at the dentistry model. And what I mean by that is kind of the traditional practice, general dentist is you've got one doc, you've got 2 to 2.5 hygienists, you're doing a lot of hygiene exams every day and hoping, hey, with those clinical at bats from the exams, I'm going to find dentistry to be done that's going to help fill my chairs, but those do take a lot of time. Anyway, so I want to hear, because I think I know the answer, but I want to hear, what was your strategy going into this startup? Did you want to do kind of a one doctor, two hygiene model, or did you have something else in mind?
Yeah, so I always wanted to, have a bigger practice. At the practice I was at before, uh, the hours were open were from 7 a.m. to 8 p.m. And that really
Okay.
opened my eyes, um, you know, thinking we maybe like a split shift. So right now that's what we do. And we started that from the get-go, right when we opened. So for instance, Mondays and Tuesdays, I work from 1 to 8, and the other doctors work from 7 to 1. Now we have 4 doctors now, so we have 2 on at night, 2 in the morning, and then we switch. So that right there just increases your production by twofold. Essentially, you're getting 2 days out of one. So that's been huge for us, just production wise.
And then tell me about the hygiene team. Do you have 2 hygienists worth of appointments you're doing exams on each doctor, or do you have fewer hygienists than that? Talk me through that.
Yep. Yeah. So each doctor has their own team. Their own team consists of 2 hygienists. They're always the same hygienist.
Cool.
2 EFTAs and 1 assistant, 1 front desk person as well. So it kind of creates like 4 small practices in one,
Fun.
big practice. It's great with continuative care and such. So yeah, each doctor has 2 hygienists.
Yeah, that's great. And then tell me about new patient flow too. One of my last questions, and I'll share maybe a few stats, and that'll like get you talking about some stuff. New patients, are most of them, because you've got a ton of new patients, even still to this day, that come every single month. What's the split between new patients that are coming in for hygiene, so they're directly going into hygiene, versus going directly to the doc? Like, what are they coming in for that's getting them in your practice? Because you have really high retention, like exceptionally high new patient retention, which has allowed you, like, it's so fun to look at your chart. Like in year 1, you went from, 0 patients to 1,000 active patients to 2,000 active patients to 3,000 active patients. Like the growth has just been, seems like clockwork. So talk me through how patients are coming into the business.
Yeah. Riley, who's on board here, is big help there. So we do a lot of marketing through Energize. What that's great for is they bring patients right to me and not through hygiene. So
Yeah.
for instance, when those patients come in, they have clicked on an ad that says, hey, I'm interested in veneers, or I'm interested in implants, or I'm interested in, dentures, or whatever it may be. Which is great for a doc to have somebody come in asking for that, instead of, going through hygiene and kind of trying to convince, a patient that, they might be a good candidate for an implant or veneers or, Sure Smile, Invisalign, what may it be, which is great. So we get a lot of our production, major production, big cases from consults that Riley and Energize bring into us. And then we have, most of our patient base, probably 75% of them, come in through, just word of mouth referrals, through hygiene, need a new dentist, get, their cleanings and might need, a crown or two, or an implant, or, Sure Smile, stuff like that, some of the smaller stuff. Which is it's a great mix, because we have the people that, from the community are here to stay, just want their annual checkups, and, their mom told them about or whatnot. And then we have the high production cases that, Riley and Energize are bringing in. So it's a great balance.
And then tell
Tell
me, like,
me,
oh yeah, go ahead, Riley.
I want to understand. I want to dive a little bit deeper on this, because I know behind the curtain a little bit more than Steve does. And it's fun to hear him look at this and say, you know what, this is clockwork. Everything has been looking good. Because I know behind the curtain, in the first couple of months, it was not rainbows and butterflies. I want to hear. Tell me from your experience, first couple of months with starting out marketing. When did you start to see the hang of it and see things start to blossom there?
Yep. Yeah. So I started the practice in my hometown, right? So right when I started, I knew I'd get a lot of family, friends, and whatnot. We started to market as well. So the first 3 months, the marketing didn't go as planned, and most of my patients were from family and friends. So Matt Brown, who owns Energize, I called him up. I said, I think you're making these patients up. We haven't gotten any patients from Energize. 1 or 2 have showed up. Like, I was banking on you guys to give me some patients, and I'm relying on my family and friends. What's going on? So we got into a bit of an argument. I'm a very impatient person. I want stuff now. And I realized in marketing, that's not how it goes. You have to kind of build yourself up. We had to build our reviews up, build our Google page up, kind of get the word out there, who we are. Because I think when people do click on the marketing stuff, they still will check us out on, our Google page or our website or whatnot. And Matt said, give us 1 more month, and I promise it'll kick back into gear. And This was 3.5 years ago, or a little over 3 years ago. And we haven't looked back. So after that 3-4 month period, it's just been straight up. So I'm glad that I hung in there, because I was pretty close to cutting the cord. And later realized, talking to other people, that marketing, it takes time. So if you're out there and you're listening, hang in there. It takes a couple months.
That actually is such good advice,
Yeah.
especially for scratch practices. It
Yeah,
makes
yeah.
sense. Like there's just not a presence there. I mean, today I just pulled up your Google page and you got 713 5-star Google reviews. Like that's pretty easy for a patient to come and look at and be like, oh yeah, like I'm going to this place. But yeah,
Right.
if you were to jump on and it's like, 5 reviews that's all the same last name as the doctor, it's like,
Exactly. Yeah.
oh, like
Yeah, exactly. And we didn't have a lot of patients, so like my anxiety was through the roof. I had the time sitting here refreshing my computer, waiting for, that patient to book. It was tough, but after we got past that stage, we really haven't looked back, and they've done an awesome job with us and been a huge part of our success.
I want to ask now about the growth, and I want to use like operatories as that growth measure. So when you started, was it just you, 2 hygienists? Tell me like the team when you started and how many operatories you were using, and then let's talk about kind of operatory growth over the last 3 years.
Yep. Yeah. So when we started, we had 8 rooms plumbed and we had 3 rooms filled. And about March, so we're open about 4 months, right around that period. Riley started finally sending some patients.
Finally.
We hired a hygienist. We started getting pretty busy. So I was doing cleanings for the first 3 months. Weren't pretty cleanings. Got some bad feedback from family and friends afterwards, but all worked out. And then when I ordered the chairs, it took about 3 months because it was during, right after COVID.
Yeah.
Finally got those 3 other chairs, and by that time we needed the other 2. So I said, just order the rest of them. So within probably 6 months, we had the whole thing filled out.
Wow.
Did we need them all? No, but it just took so long for us to fill the chairs, or to get the chairs from ADAC. We just said, let's get them.
Get ahead of it.
It allowed me to kind of sprawl out and spread out. So I could, really run like, 5 rooms at a time, especially with
You were managing, as soon as you brought on a hygienist, you were doing the hygiene exams, but then you also had all of these patients from marketing coming into the consult room. So you needed consult rooms for them. And then you also needed to go get dentistry done and produce.
Exactly.
Okay.
Yeah. So we kind of just opened our availability, anybody that would call or walk in, we'd say, just come over now, we'll make it work. So I feel like we filled the chairs in pretty quickly. We hired our first part-time associate, I would say, in 1 year. And he worked Thursdays and Fridays. And then in July, so 6 months after, so we're 1.5 years in, we hired our first full-time associate. And since then, we're on like a 6 to 9 month hiring a full-time associate.
That's incredible. And then tell me operatory space. So right now, how many full-time do you have? How many ops? And how are you using each one? And hygienists too would be helpful.
Yeah. So we have 4 docs. Each doctor has 2 hygienists.
Okay.
So we have 8 hygienists.
Yeah.
We have 8 operatories, so we work the split schedule. So all 8 operatories are booked from 7 a.m. till 8 p.m. Monday through Thursday, and Friday we're here 7 to 2. Saturday 7 to 2. So we get the most out of our chairs here, and we're actually, we're busting at the seams. We bought the place next door, and we're expanding from 8 operatories to 18 operatories. So that will be, chairs just got installed last week, up and operational in probably like a month or so.
Okay, incredible. And you've got space to sprawl. And then just to remind everyone, they're running split schedule. So if you hear, the 4 docs and 8 hygienists, that's technically 8 operatories for 2 doctors, 4 hygienists, right? So each hygienist has their own op, I'm assuming. Are you running assisted hygiene or traditional hygiene? So they've got each of those hygienists have their own op, so 2 of them, and then each doc has what does that leave for the docs?
Each doc has 2 restoratives.
Has 2 restorative ops. Yeah, that's right.
Yeah.
So, and then are you running consults in those restorative ops as well, or do you steal some space from hygiene sometimes?
Yeah, so the consults are
Or do
coming.
you have a different consult room that's not even in an op with a chair?
Starting next month, we will.
Okay, cool.
So that's one of the, reasons for the expansion. But right now the consults are running through the restorative. But next month we're gonna have an op dedicated to consult only. So I'm really excited for that.
I'm going to ask your opinion. Sometimes I hear people that want the consult to happen in the chair because they want to focus on some same-day dentistry stuff. Now, if you're getting into more complex procedures, then that's not possible. Sometimes people want to have just make it easy for themselves, and it's cheaper to have a consult room that doesn't have chairs and equipment and all of that investment in it to just start that conversation. So what's your opinion? Would you rather have the consult room or have them come through the chair for some same day dentistry? What's your thought on that?
I like the chair. I've tried a couple consults in my office. Every one of them always ends up with, all right, well, let's take some x-rays. And then I'm kind of, all right, open your mouth and go like this. Let me just kind of see what's going on. And I'm like, I need information to give you a good treatment plan and kind of figure out what we need to do. So for our consults, we write off a lot. We don't charge anything. We'll take a full mouth, we'll take photos, we'll do an intraoral scan, CBCT, and we'll get you, your actual treatment plan. I feel like that's, for me, I want to know and make sure that I can do the plan before, giving somebody a quote or whatnot. Somebody might not have enough bone for an all-on-4 or whatnot. So that's how we do it anyway.
Yeah, that makes a ton of sense. I wonder, I was like thinking through, I've got an 8-year-old. We're just at the beginning of his like orthodontic consultation. And in ortho, they do like a unique thing where they're using like a combination of the chairs and rooms where you get kind of that clinical review and the chance for a doctor to look in the mouth, but then they free up that chair by moving into consult rooms for different pieces of the conversation. So they're not like clogging up, that chair time for for listeners' sake. I think there's probably, some space there, depending on, I just know there's some practices that are just like busting at the seams. They're like, how do I maximize use of these chairs and, the office space I have? So
that actually is a good idea, the combo thing, like kind of get all your records and everything and then go to an office. That is a good idea.
Where you can do some of the review and then free up that space for additional patients to come in.
Right.
Okay, so let's talk about some like key systems. Are you cool with going that direction? So today,
yeah, absolutely.
You got this big practice, you're expanding.
Absolutely.
I'll rattle off like a few, if you're okay with this, a few kind of like things that your team is exceptional at. So, a couple of things. One, patient retention is like through the roof. So the biggest number that leads up to that is hygiene reappointment percentage. Like how many people can we get to say yes to the next appointment today? Your team is in the top 10%. They're consistently like 95% plus on that number. The average practice is around 80% now. So like way above. So your retention is great. Another huge one, people don't think about this, but especially in a practice like yours where it sounds like the majority of patients are coming into your chair first before they go to hygiene. That creates also a lot of risk that we lose those patients if they don't say yes to treatment. So we want to think through how can we convert them into hygiene, and your practice is really good. You're also in the top 10% at taking new patients and scheduling them for hygiene as well. Even if they're coming in for that restorative consult, you still get them scheduled for hygiene. So I might want to hear a little bit of that. And then I think it might be worth hearing a little bit about kind of your approach to clinical presentation, because your case acceptance numbers are really high as well. Like when you present high dollars, you get good case acceptance, as well as when you present, bread and butter dentistry, they say yes. So patients are highly compliant. And I'll shut my mouth. Let you tell me like, which of those conversations do you think like, hey, like I think that's interesting. I think my fellow doctors will be interested in that. Let me share kind of what I know and what's worked.
Yeah. So interestingly enough, I know my stats are pretty good, but I'm really not a stats guy.
Okay, cool.
I'm more of like an experienced guy. I look at stats to kind of tell a story of, kind of what went on.
Yeah.
So when we, started Dolan Dental, I wanted to create a really exceptional experience for the patient.
Mhm.
Everyone's scared of the dentist. Everyone that comes in pretty much says that. So we wanted to solve that. So starting from the phone call, getting a new patient in, being nice and polite, getting accommodating, trying to get them in as soon as possible, to the hygienist, being nice and gentle, and just creating, a nice calming atmosphere, to the EFTA, if you're getting filling, to myself. When I look at a practice, there's 4 doctors and we have 30 employees.
Mhm.
So the communication between, myself and the patient is what, 15% of the time. Usually they're communicating with the team members. So I rely heavily on my team. I think I have the best team in dentistry. I really think that's what separates me from, or our practice from others, is just our team, the way we go about things. Because if you create a positive experience for the patient, they're way more willing to accept treatment. They're way more willing to book at their next appointment. They feel comfortable. They feel like they trust you. And I try to get that feeling out of the patient before I even walk in the door, before any of the doctors walk in the door. We rely heavily on our team, and I just think that reflects in the numbers. We do focus on, hygiene reappointment rate and all that. We try to get the patient any sort of appointment on the books before they leave. Even if they come in for a consult and they're not really sure what they want to do, say, well, let's, put an appointment in 2 weeks. Why don't you bring your significant other in and we'll chat? 50% of the time, they cancel that appointment, but we at least try. We try to get something on the books.
And operationally, is that happening in the back office in the op, or is that happening up front, or do you use front as like a fail safe?
Usually, so for hygiene, it's happening in the room.
Cool.
For any restorative appointment, it's happening up front.
Perfect. And those team members know, like, hey, that's one of my goals with each one of these conversations, is to have that next scheduled appointment.
Exactly.
Cool.
How, with a team as big as yours, how are you training that? And like,
Yeah, I was gonna
how do
ask
you
the same
hire
thing.
that?
So,
How do you train it? How do you create it into a habit for these team
yeah.
members?
So you hire a new team member, and how do we train them? How do they know?
Speaker issue there.
Oh, we
Can you?
got you back.
Yeah.
Yeah.
I didn't hear what you said. I'm sorry.
Oh, that's good, Riley.
No, you're good. So yeah, for a team as big as yours, I'm curious about how you're hiring and training and creating a habit for these team members to make sure that they're focused on this experience.
Yeah. What all started right from the get-go. The first 2 people I hired were great, and we just created this culture. And now when I hire people, I pretty much say, like, you guys are going to be the ones that are going to be spending more time with this person than me.
Mm-hmm.
You guys look at the resume, you guys bring them in, you walk them around, show them around. If you feel like they would be a good fit, we're going to have them come back and do a working interview. Pretty much everyone does a 2 to 3 hour working interview where we really just see how they would react with us and how we would react with them and with patients and such. And I kind of go around and say, do we want to hire them or no? So it's a full office, commitment there, because the culture we have, we don't want to break it. And it's kind of like, you fit in or you don't. As far as training, we're really looking for the personality that we can, feel like we can train anybody. If you have a good personality, you're open and willing to learn. And the team members that I have, my head EFTA, my head hygienist, front desk, they're all great. So I just really rely heavily on them, which is awesome to have.
And then for training, do you rely more heavily on, and maybe it's a combination of these. On one end, you might have someone who's like, it's like documentation, SOPs, like go read my manual and you know how you need to behave within the business. On the other end, it might be like, hey, a player coach model. This team member is kind of the model of how we want to behave. So we're going to have a player coach kind of follow along, and then you'll see how we work. And I want you just to do that. On that scale, where would you suggest you guys are?
We're all the way to the player coach side.
Okay.
I don't know if we have much documents in here. I mean, we have like, paperwork that'll show you how to do things for this.
Yeah. Do you have any like checklists or anything like, hey, here kind of daily tasks or? Okay,
yeah. So we have a bunch of checklists, a whole lot of checklists, kind of like to follow with. So I guess we're kind of in the middle if you put in checklists.
Yeah,
But more
checklists
so
for sure
like,
count, because that's like, hey, here's what we want. Here's what success looks
exactly.
like. If you get these things done, then like we're all humming. If these things
Yeah.
don't get done, then things are gonna break.
Exactly. So we do have checklists for pretty much
Cool.
everything. But really what they do is like you're gonna follow somebody around for 2 weeks and then you're kind of on your own and we're here to help you. But you know, we don't have like a specific like training, you know, protocol or anything. It's kind of like, you know, we're gonna show you what's the Marine saying? See one, do one, teach one. It's kind of
Yeah.
like that.
Sounds good to me. Yeah, I like that. That feels like a good, like not overly engineered model where you have some consistent checklists, like the
Yeah.
outcomes you
Yeah,
want to
yeah.
have happen, but then allow them to experience it with the player coach and then graduate from that and then execute. Yeah, I mean, it seems like that would, as a team member, I'd be like, okay, cool, yeah, I got that. I can run in that system.
Right. So the checklist definitely guide them, you know,
Mhm.
into the right direction.
Cool. Now talk me through, like, as a business owner, is your plan like infinite growth? You're gonna have 18 operatories, so I mean that's a massive growth plan. Are you expecting to have to do anything differently, or do you think you can just kind of keep putting fuel on the same fire and tell Riley and team, hey, we need now 400 new patients a
Yeah,
month?
right.
Uh, so
Yes.
talk me through that. Like, what does that look like?
Yeah, so I know in the next couple of months there's going to be operational changes,
Hmm.
just with workflow. You know, having some more operatories. We're going to have to change things around, like you know our dentrix and communication. A lot of communication things going to be key in the next couple of months. But essentially, the plan is to stay course. You know,
Hmm.
in 6 months we're probably going to need another doctor, and then in 9 months after that we'll probably need another one, and hire until you know I think so. We have four right now. Actually, we'll probably max out at probably like six or so, and then just
Hmm.
kind of start trying to fill in all those rooms there. Um,
Ooh, can I ask you one question that just popped in
yeah,
my head? Since you're talking about hiring associates a bunch, you expressed when you were in that associate role, you're like, man, I want like more at bats. Maybe I want to buy in. Talk me
yep,
through, because associate hiring, I mean, that we could do a whole episode on it. I'm sure you could
absolutely,
talk
yeah.
about missteps you've made or like how you might think about it differently. How did your experience as an associate play into what you're doing? So yeah, talk me through associate hiring, maybe briefly. Like, what's your strategy there? Are these like associates that are on a salary? Are they partners with you? Talk us through
Mhm.
that.
Yeah, so I got really lucky. I have three awesome associates here, and they're all killing it. It makes it like fun when you have somebody that you know you can work with and bounce ideas off of and really trust. You know that's the big thing. Um, when you know we hired them and interviewed them, I pretty much made it known that you know it's Dolan Dental, and my plan is in 25 years to give the business to my son. So I
Yeah,
really don't want any partners, but
yeah.
I'm such a like a business
Which is
mind.
great to know coming in. Like, part of your problem was it sounded like you kind of thought there was a shot at buying into the practice at some point, and then,
Right, right,
oh wait, that's not going to be the chance. So
right.
expectations being super clear is so important.
Exactly.
Yeah,
Exactly. And we've had, you know, a lot of good candidates not, you know, join us for that reason.
I'm sure.
But, you know, it's better to kind of know that and get that, you know, off your chest right away
Yeah.
than hide anything. I'm very open. But my associates are awesome. At some point, you know, we're gonna outgrow the 18 ops. I really don't plan on opening up another office. But what
Hmm.
I said to, you know, the other associates is, you know, maybe we can go 50-50 on an office with where it's kind of your office and we replicate everything that we
Yeah.
created. We try to bring your team, your patients and everything over there and continue to grow that way.
Mhm.
Which I think is a model that's probably not used much.
Yeah.
Um, Also, like when you get this big and you by the time you know and associates are ready to buy in, you know that it's going to be a big number. It's going to be you know
Yeah.
like kind of tough. I would almost feel bad like they helped me grow in, and then it's like, all right, well, you know, here's this big number if you want to join.
Hmm.
So I think that would probably be the way that we go. You know,
Yeah.
we'll approach that probably in like you know a year and a half or so. We'll
Hmm.
start really talking about that. But that's what I'm thinking right now, anyway.
Yeah, I like that. And
I want to hear a little bit more about your goal progression on that. because I'm just wondering at the very, very start of all of this, was your goal, hey, I want to hit 100,000 a month? Or was your goal, hey, I want 18 ops in this space. I'm buying this neighbor's place at year 3 to 4. Like how have your goals adapted and progressed throughout these years, even to now saying, yeah, next steps are 50-50 partnerships with these people. Like, yeah, I want to hear more about that.
Yeah, I mean, when I bought the place, I really just wanted to fill it out, and I realized how quickly I'm like, wow, I think we got something special here. Our growth is tremendous. So then I always thought maybe, we get a couple other ops, maybe 2 extra ops, an overflow op and a console op. And within, 6 months of having that idea, I'm like, wow, we're gonna need like that whole entire other space. Um, but I do think that, I'll probably max out that with that space, just sanity wise,
Mhm.
I really try, like I try to run a tight ship and, be super involved and be here. I do love it. I really do. Obviously I got to spend some time with my family, but, I really do love it, very fortunate. It would just be too much for me to open up another office or whatnot. So probably stop at this.
Ooh, I just realized there's one other question I haven't asked, and that is, I'm assuming you have like a more advanced like business administrator, office manager in the business. Do you have one?
Yeah.
And at
So
what point did you like invest in that? Because I think when you do the scratch startup, you're doing everything pretty much as an owner doc for the most part. Like you're doing
yeah,
cleanings, you're doing a lot of times you're like either hiring it out or you're doing it themselves, submitting claims or collecting payments. Like you're just trying to like spread yourself super thin until you can get enough profit in the business to start adding employees. So yeah, talk us through like, do you have kind of an admin team beyond the front desk, and how have you, when did you invest in that?
yeah. Well, one of my first hires was our office manager.
Cool.
She's been great. And then about a year in, we hired a business manager. And she's incredible, probably the best treatment plan presenter around. And that really helped. She's all into analytics and stats.
Mhm.
So she would kind of control that. She was probably the main reason why we're so high on hygiene reappointment.
Yeah.
She helped me kind of point all that stuff out. Um, so probably within the first year, now I kind of have like some other front desk people that I'm kind of just giving, certain things
Yeah.
to that they're really good at, kind of spreading the wealth a little bit. So I would say almost everyone at our front desk has a pretty big role in something other than just, talking on the phone and checking people in. They have some other responsibilities that are super important. But that's really important to hire a good office manager, a business manager to help.
And then tell us a little bit about roles. So,
Yeah.
there are the office manager or business manager can be so different in different practices. And, a lot of that has to do with skill, or some of that has to do with like how much is a doctor willing to let kind of someone step into those roles of authority. So,
Right.
hiring, payroll, purchasing, managing, like even like paying leases and stuff like that. So, actually, like making payments for the business. So, for you, how quickly did you let go of stuff? Are you still holding on to some of those like high
Yeah.
level business things, or do you kind of like say, I want to step away from that? I want this business manager to do it, and I'm going to help hire associates and maybe some of the clinical training. Yeah, talk us through the splits between you guys.
Yeah, so that it's pretty tough to let go. It's one of
Yeah,
the
it
issues
is.
I feel like I find myself in. I feel like I'm responsible. It's my name, and
Yeah.
I want to try to do it, and I end up not even getting to half the stuff from late because I try to hold on to so much stuff. Um, so I do have a hard time with that, and it's something that I actually plan
It's
on getting
normal,
better.
by the way. I'm not saying that you're like
Yeah,
a problem. That's
yeah.
normal. Like it's your baby.
Yeah, you would think it would be easier, like you're dishing stuff off that you're not going to have to do. But
Yeah.
for some reason, when it's your business, it's harder. Like you want to do
Mhm.
everything. You realize you can't. You run yourself thin. So I'm kind of in that spot now where I'm hoping in the next year I really cut back on the admin stuff that I'm actually doing, and kind of siphon that off to different people.
So you're still doing quite a bit of like business administration stuff.
More than I think I need to.
Okay.
Like I don't do payroll and stuff like that.
Yeah.
It's taken care of. But I really
Like this
should.
lease and expansion, of the new property, heavily involved in. Like
That's
you're the project
pretty
manager
much
for it.
all me.
Yeah.
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 Team hiring.
Team hiring within the last like 3 months, I kind of took myself out of. Like I have the final say, of course, and
Uh,
but with our team, like if they fit in, you guys know, if they're gonna be good, there's enough is if it's not one person that makes the call, it's a group effort. So I say you guys kind of decide, and then if we hire someone you don't like them, it's your fault, not me. You can't yell at me anymore.
yeah,
I'm curious with that. So it's like you have a team of people that are all going through or all watching this interview. If one of them says no, is it just a no, or is it, hey, as long as 80% say yes, or is there a way that you're quantifying that?
Not really. It's definitely an imperfect system. But I try to have the person talk to like everyone, and
mhm.
then afterwards I'll kind of get to say, how do we feel? It hasn't really been a split decision. Usually it's like, yeah, we really like her, or like, yeah, we might
Yeah.
not, they might not be a fit. And if there is some sort of discrepancy, I'll kind of like bring the two people in and like let's talk it out. Let's figure it out. Is it something stupid, or is it something that we really should consider?
Now, Dr. Dolan, where time flies so fast. We're already like coming up on end of time. I'd love to hear for listeners. I don't know if we've made this like super clear, but we have thousands of patients in the business. You had your first month in October. This was from a post that Riley did or you did. I'm trying to remember who did it on Facebook. This is what like
Yeah,
the podcast in the first place.
yeah.
First month where you guys did over 400,000 in collections in a single month. Like there's just cool things happening in the business. I
Yeah.
want to hear maybe a good getting us to wrap up question would be, what advice for those out there that are like, hey, I either want to like improve my current practice, like I'm struggling with my current business, or I'm thinking about getting in a scratch practice. What advice would you give to your peers about growing a successful dental practice, running a successful dental practice? Like, what do you feel like are some lessons you wish that someone could go and tell you, rewind 3 years?
Yeah. I guess it kind of back to like what I was saying earlier with like almost like reverse engineering your statistics. For
Mhm.
instance, like case acceptance is probably the one big thing, right? If you have
Yeah.
high case acceptance, you're probably a good practice. If you have low case acceptance, you probably don't. Like, why isn't that patient accepting? Is it because it's a bad experience? Is it because you're, over treatment planning or whatnot? I really think that, our team creating that culture, it makes it so much easier for us to communicate with the patient, the way we want to, and for them to trust us. When we bring up a CBCT and x-rays and IOPs and photos on a computer and try to explain that to a patient, that reverse engineers our case acceptance.
Mm.
So I guess, if you're looking at, the statistics, I feel like statistics really tell a story of, kind of what you're doing. So I guess, kind of see what the problem is, and don't concentrate on that. Concentrate on, kind of how to fix it, like in the back end, what's causing that issue, if you will.
Yeah, I love that. So kind of this mindset of continuous improvement. I'm gonna like get a baseline, like how are things going and where do I want to improve? Case specifically is a great one for people to focus on, like become like hyper focused on how do we improve that experience, make changes, and then see if it improves it, and if it does, if your numbers are
Right,
getting
right,
better, the stats are getting better, then say, okay, that's how we're gonna behave moving forward. If it's not moving the needle, then oh well, the thing I thought was the problem wasn't. Let's keep discovering what are we going to change next? Like, what else could be the problem? See if you can improve.
right,
I love that, and just constantly be
right.
kind of tweaking with the business. Like, hey, where can we improve? How can we make it better for patients? Yeah,
Yeah.
I like that a lot. Other advice?
Um, Other advice, I guess try to stay positive. Dentistry can be a, pretty
Uh-huh.
negative place with, our patients and even our peers.
Yeah.
Um, Try to just stay positive, keep a smile on your face, and
Mhm.
um, you know, create a good connection with patients. And I think, I think that'll all work out.
Yeah, I think that's good advice too. Yeah, find a good therapist,
Yeah, right.
marry well.
Yeah, yeah, yep,
Yeah, that's
absolutely.
that's that's good advice as well. The last question we ask every single podcast guest, I didn't prep you for this because I want to just kind of hear your answers. We ask them the question, what does growth in dentistry mean to you? So the name of the podcast is the Growth in Dentistry Podcast. And we just like to hear from each individual, like, hey, when you hear that phrase, growth in dentistry, what does that mean to you?
Yeah, to me, it means like dentistry as, professionals, as a community. I feel like a lot of times there's a lot of judging between, dental professionals and such. Going on a podcast like this, like, I want to try to encourage, people to reach out and help each other, whether it's, a general and an oral surgeon or other generals helping each other or hygienists helping, I feel like people are scared to ask questions and scared to put themselves out there. And just kind of saying that, if anybody, has any questions or whatnot, I'm an open book. Feel free to reach out to me. Or, anybody on these podcasts. Podcasts are great. I feel like it is helping, the growth of dentistry. So I would say just as a community,
I love that. Now, for those that are listening, what's the best way for that? If they're like, hey, I want to hit you up, Dr.
Yeah, absolutely.
What's the best way
You can
to reach you?
Yeah, Instagram's probably the best.
Cool.
I believe my Instagram handle is Fran_Dolan_DMD. If not, you can go to the practice. It's Dolan_Dental. Reach out, any questions. I feel like I talk to a lot of people, through the Facebook groups and whatnot. But just encouraging everybody, out there. I know it's tough. Feel like dentistry, a lot of times you're out there on an island, you feel like.
I just went to Instagram just to confirm. Yeah, Dolan and then the _dental.
Yes, correct.
Yeah, is the handle. Sweet. Cool, man. Well, thank you. Seriously, thank you
Cool.
so much for coming on. You've got a really incredible story. It's fun to hear, like just the thought process. And you're also just so relaxed. I wish you could, I'm sure there's way more stress than you're showing where you're like, nah, dude, like the last 3 years have been an absolute mental, emotional grind, which, could probably be an episode as well. But thank you
Right.
thank you for willingness to come on and share. And for those listening, what a great episode. So thanks, Dr. Dolan. And for those listening, we will, this has been another episode of the Growth in Dentistry podcast with Dr. Dolan and with Riley Beck from Energize. Thank you for joining us today, and we'll talk soon.